it's not just about layering on digital onto a broken chassis. They need to evolve together. And of course, it's really challenging in a healthcare environment where it's very complex and there are so many intertwining factors. So we need to take sort of contained and controlled, but forward progress steps, both from an operational standpoint, and then layer in the technology that enables a different operating model along the way.
Welcome to This is Digital, a podcast brought to you by West Monroe. Join us as we talk to leading experts about bringing the digital mindset to your organization.
Welcome to This is Digital, a podcast about leading with digital to win in the marketplace. I'm your host, Rissa Redden, Partner and Chief Marketing Officer at West Monroe. On This is Digital, we talk to experts about how not to just do digital, but to be digital at your core, and what that means given the institution or company. Today, I'm delighted to be joined by Sara Vaezi, who serves as Executive Vice President and Chief Strategy and Digital Officer at Providence. Sara joins us to talk about the role of digital and technology in the healthcare flywheel and how companies can connect with their customers, in this case patients, when they're not necessarily needing or thinking about them. With that in mind, I'm excited to dive in. Sara, I'd love to hear a little bit more about your background. Could you tell us what brings us to this moment?
Yes, absolutely. And thank you so much for having me, Rissa. This is a lot of fun. I'm looking forward to the conversation. So I've served with Providence for about 8 years. And prior to coming here, I was a management consultant, but still in the healthcare and specifically in the provider sector. Did a lot of work with IDNs and academic medical centers focused on enterprise strategy and work in population health in particular. Before that, I worked in the health policy and health services research domains with a lot of different state agencies in Washington State where I lived, including the Healthcare Authority and the Office of the Insurance Commissioner on a variety of different things like early high-tech work and medical home implementation for Medicaid insured people in our communities. And then before that, I started my career as a research scientist at a medical device company focused on therapeutic ultrasound. So I've spent my entire career in healthcare and healthcare adjacent and just really love it and have really valued the evolution that I've seen in healthcare over the years.
And could you talk a little bit more about that? What is the evolution that you've had a front row seat for, and what has surprised you with that evolution?
I would say a couple of things. First, this is in like the mid 2000s, a lot of focus on hospital-based medicine, building out your hospital-based programs and things like RVUs to drive productivity. And it was very much, fee-for-service oriented strategies, fee-for-service oriented medicine, fee-for-service oriented economic models. And it was all about just building systems that allowed us to do that. And it was either within the hospital setting or programs that the government was supporting that kind of worked within that construct. How many medical groups are you going to go acquire to do XYZ? And then with the Affordable Care Act passing and being kind of finally definitively settled on in terms of the law of the land, started to see much more of an evolution, at least from a conceptual and financing perspective around value-based care and how we need to start actually caring for communities and populations. And then, actually I started at Providence in the earlier days around sort of the consumerism notion, the earlier days of how as high deductible health plans became more and more prevalent and cost sharing among consumers really became a key driver for a different conversation in healthcare, which is like, we really need to be serving people much more effectively. In addition to that, we've seen this huge digital consumer boom in so many other parts of our lives that the expectations we're starting to finally translate into healthcare as well. And so it's been this sort of interesting journey to witness that. And then not only that, but the consumerism, I would say, ramp up was coincident with the funding cycles, especially venture capital coming more and more into healthcare and funding a lot of software as a service type offerings that started to impact the industry from an offering perspective. So, just sort of like the technology revolution, the consumer revolution, all of these things kind of started to emerge in the mid 2015, 2016 is when I joined Providence. So that's some of the evolution that we've been there for, and right place, right time to some extent.
On This is Digital, we've talked a lot about customer expectations and shifting customer expectations. Would you say that there was a bit of a tipping point with the convergence of the different factors that you were discussing?
I don't know if there was like a specific tipping point, because we don't function with fully transparent information, for instance. And, price transparency is becoming more and more of an issue, but there's still challenges associated with quality transparency and other things that would be consumer expectation doesn't fully translate in the context of healthcare, because there's a lot of opacity associated with just how the system functions. It's very much an expert system. And even experts, quote, air quotes, like us, struggle with navigating the system, understanding the system, figuring out how the individual pieces interact. And so I don't know if I would call it a tipping point. I think it's just the lack of sustainability. And last year, in terms of, when I talk about last year, I mean 2022, when it became very clear that the economics of care delivery especially in a hospital-based environment, are just completely unsustainable. And many health systems experienced a tremendous amount of loss and this sort of perfect storm of economic factors, workforce challenges, all crashing down at once. I think it's just been this like swelling. I wouldn't call it necessarily a tipping point. And the system itself is now so brittle and close to breaking in a really significant way that I think that's what we're seeing, but it's just getting, I don't want to say it's just getting worse. I don't think it was a tipping point. I think we're seeing a different kind of phenomenon.
How is your company leveraging generative AI? If you're trying to get the most out of this new technology, check out West Monroe's new video podcast called This is AI. Our AI experts show you real examples of how to use AI for the best results. You can find This is AI on YouTube and wherever else you listen to podcasts. And with the different factors that are converging, is digital the answer to all of those problems, or is it a piece of the puzzle? How do you think about the role that digital plays?
Digital is a big piece of the puzzle, but it's not the full story. With any technology and digital, I would say this first. Digital is not just about the technology, it's also about the business model transformation. And those two things go hand in hand. But how you would drive adoption of those things is a key factor in terms of, and driving adoption within the context of, okay, how do you actually operationalize a technology and make it, work within your environment, is a key factor in getting any value out of it. And so technology is a part, but the operational transformation that we need to do is, and I would say, an even bigger component.
And is there an order of operations, meaning you need to have your operating model set or solidified before you enable it from a digital standpoint? Or is there more of a feedback loop between the two?
It's not just about layering on digital onto a broken chassis. They need to evolve together. And of course, it's really challenging in a healthcare environment where it's very complex and there are so many intertwining factors. So we need to take sort of contained and controlled, but forward progress steps, both from an operational standpoint, and then layer in the technology that enables a different operating model along the way. So they go together, and there's definitely a feedback loop.
And, when you think about healthcare, I've heard you use this term around healthcare as a flywheel. Could you talk a little bit more about what you mean when you say that?
So any flywheel, and this is not a new concept in many other industries, but this is something that I do think we are just now starting to adopt within the context of healthcare. So any flywheel is sort of a model that keeps folks coming back. And that's the sort of simple way of describing it. A couple of models that exist outside of healthcare, for instance, are like Starbucks keeps folks coming back in terms of buying their their coffee products and or other products as well. And they do that through a combination of like making the drink and everything that you want, their digital experience, which is a really personalized, logged in experience that's on web, it's on mobile, it's, omni-channel, and actual loyalty programs like stars and things like that, combined with their prepaid gift cards. Like that's the Starbucks model for their flywheel. And Amazon has their own, flywheel model in terms of Prime, you pay and then you get free shipping. And then they have all sorts of other offerings. Like it's convenient, it's accessible, it's the price is very clear. You have very wide inventory, right? So those things keep people coming back. In healthcare, it's a bit more complicated because we're not just trying to get people to consume care delivery services. Those things need to be clinically appropriate. They need to be necessary. They need to, kind of make sense in terms of what that person needs. But if you think about what does a person need, it's not just care delivery services. There are other things. We need to start thinking about people much more holistically beyond the 2 times per year that they need a clinical care in a clinical care setting. They also need maybe to refill their medication. And that doesn't require them coming in to visit with their doctor. They might have a curiosity about some seasonal sort of sickness that's going around. They might need to be vaccinated. There's all sorts of things that we can do. And they might need over-the-counter medication. I mean, there's all sorts of stuff, right? And so we got to know users in the healthcare context to be able to build a flywheel around them that extends beyond sort of just the last mile of clinical care delivery. And that's really the notion is you have to understand a person, in sort of, I hesitate to use overused terms like a 360 view, but we got to understand people as whole people and then be able to serve up the thing that is most relevant to them at the right time. And these are not, again, new concepts. Like marketers do this all the time in all sorts of industries, but it's a bit more challenging when we think about it in a healthcare context.
Well, and with the examples that you were just sharing with Amazon and with Starbucks, there's a reduction of friction. How do you think about friction in healthcare? I mean, it's to your point, it's a very different set of circumstances. And how have you been thinking about that?
Friction is actually a very complex issue, I think, in healthcare, as you've described. And some of the points of friction, I think, are in some cases almost intractable problems. For instance, like the prior authorization process and the back and forth between payers and providers and how your benefits are structured and what's in network and what's out of network and how you're going to get something approved. Like some of those problems, I think, we're not tackling them yet. However, there are other places where we can be more systematic about reducing friction. For instance, show me the information that's relevant to me. Make a single access channel that knows who I am and then personalizes the experience and helps me navigate it in terms of what's the next best step for me as an individual versus making me figure it out on my own. There are certain elements of friction that we can take out, even if the back end process is still like someone typing something or, doing all of that kind of stuff. So I would say a couple of very key areas where we can reduce friction is like that transactional experience in terms of booking. Every endpoint that is bookable should have an option to be digitally bookable. So we shouldn't have to call in, right? Some people like to call in and some people don't. And it might vary depending on what you're trying to get accomplished, right? If you're trying to get something more complex accomplished, maybe you prefer to call in because you get a guided experience with someone on the phone, but you should have the option. Right. And sometimes you just want to interact with a bot, and that's fine too. So that transactional experience needs to be simplified, and we can do that. And even digital endpoints are digitally enabled endpoints is one, but even the process. So especially when we rely on the electronic medical record, which is not really a consumer experience platform, it's much more about, a repository for data, and it's like a highway for information. Those platforms tend to require 7 clicks to make an appointment versus 1. It is possible to make 1 click appointments, but those kind of core systems of record don't enable that. So we can take friction out in that way. The second thing is, again, having a logged in experience that knows you. So you don't have to type in your same information every time, that all of your information is in one place, and that it's not just in one place and buried, right? It's actually surfaced up, like, what's the most relevant thing to me? If I need to go get my mammogram done, I don't want to have to go into a drop-down menu of 60 different things and hunt and peck and find how do I actually get this thing done? It should be the thing that gets surfaced up to me right away. And so those are some examples that we can solve for in spite of all of the sort of systemic friction in the background.
Well, and I would suspect that a piece of this puzzle as well is we are human, and there is what we know to be good for us, and there is what we choose to do, and they can be different things. And I'm reminded of Richard Thaler's book, Nudge, which is about choice architecture and how do you serve up alternatives or serve up next steps in a way that's easy for people to do the right thing. And I'm curious how that factors into the work that you do.
Yeah, you're absolutely right. Like, making it easy for folks is showing it to them in a way that will resonate for them. And it's, again, like, you got to know people. That's the number one thing. You got to know them. You got to know the modality that works for them. You got to know the action, like when to present that action that will work for them. But all of that ultimately comes down to know me. And so you're absolutely right. And sometimes, people don't want to do that. And that's okay too. We can't force that, but there are mechanisms by which we can increase the likelihood if we, do the right thing at the right time in the right way.
That's right. Anything else that you want to cover with the flywheel concept that we were just talking about?
The one other thing that I think is really interesting, and, I use Starbucks as an example because I think they've been particularly creative about it, in spite of the fact that maybe they don't need to be because, everybody likes their morning coffee. But one of the very interesting things about a flywheel and the creativity of Starbucks that I like to think about is that it does unlock new business models. And so the Starbucks example is those gift cards or those prepaid cards that they sell, they actually enable Starbucks to almost function as a bank. They're one of the larger banks in the country as a result of it. And what they are able to do with, they sold $3 billion worth of gift cards in one quarter. And that money, they are able to then take a portion of it and fuel their own loyalty programs. So the Stars program that you get, or free drinks on your birthday, it's just a very tiny sliver of the benefit that they're getting of the float on that massive amount of cash that they get every single time. And again, these are like kind of crude, almost like impersonal economic ways of thinking about healthcare. Healthcare is very personal, but there are interesting creative lessons that we can take away from this to make it a better experience for patients and actually do things for them that they find value. And there are companies out there that are exploring loyalty models in healthcare that are not non-compliant with the regulatory environment and that kind of thing. So I think the unlocking of these interesting business models is really important, especially as health systems, we increasingly experience unsustainability with our core, hospital-oriented service, right? It's just really tough to do that. And so I think it's really exciting when we think about a flywheel to explore those things that get unlocked as a result of doing things with this sort of different underlying economic model.
Sarah, you had touched a bit on this around the importance of staying connected to patients in between visits. Could you talk a little bit more about that? And I'm reminded a little bit of the book Younger Next Year, which has a focus on prevention and going in to see doctors when you're healthy, not necessarily going in when you have a problem or something has developed. Could you talk a little bit about the importance of that connection?
Yeah, absolutely. And there's so many different threads to pull here. So there's the importance of remaining healthy. There's also I'll start with saying the average person out there interacts with 4 to 5 different healthcare brands per year, health and healthcare brands per year. Each of those, a lot of health systems historically have sort of said, they're our patients, like almost like this possessive type of thing. I don't believe that to be true. I think people should be able to interact with whatever makes the most sense for them, and that health systems actually can operate at the nexus of connecting all of these different fragmented, decentralized options. We're not fighting that. Fighting that sort of distributed, decentralized environment is like fighting gravity. We're not going to go there. So I think let's keep the momentum of like all of these like beautiful proliferation of services, but then connect the dots where it matters for the user and have a place that is not the downside of having that fragmented environment for a patient or for a consumer is that it's all over the place. Like there is no single place where their information is. They have to remember passwords. Like we deal with that in our other parts of our lives too, where we've got just like tons of passwords to memorize. And it's just like a really, you're half the time you're interacting with it, you're resetting your password. Like that's just a bad experience. So we can do something differently in the context of healthcare, where we have a place where your profile as an individual can exist, and you don't have to memorize 50 different passwords, but you can have a single sign-on protocol across all of those. So I think the bottom line here is engagement, not entrapment within a single environment, and doing so through these things that, again, like these technical environments that create a better experience for the patient. Now, on the health system side of things, there is a benefit to us as well, right? And the big difference, or rather, I should say, the big challenge in not owning the relationship, what happens is anytime someone is in the market for something, they need some sort of service, effectively, you as a system pay to reacquire them. Even if they've come to you before, they've got a lot of other options. And so if you are the relevant place for them to get that service, you're still paying to reacquire. And the relationship is disintermediated because they have so many options, and they've got, they've interacted with 5 other brands or 4 other brands in that year. So it's really important for you to be top of mind so that if you are the right place for them to get that service, they come to you and you don't have to pay astronomical amounts to reacquire them. And that is part of like the sustainability equation for health systems.
And when you think about that role as a nexus, I mean, would an example be, okay, I'm going to go get my COVID booster and I'm going to just go to the Safeway because it's just down the street from me. But that information then flows into my record with the provider so that my primary care can see that I've had my booster. To me, I love that is everything all in one place for me, but then for my caregivers or for my doctors, they can also see what I've been up to in between visits.
Exactly. That's a great example. Another example is, basically any preventive care that you get, that should apply. Right? If you're getting a COVID booster, if you're getting an annual exam or something else, or if a lot of folks are now, for instance, interacting with telebehavioral health like services, that information should have, there should be a way for consumers to access it all via one sort of contiguous experience and at least visibility for the provider in like a closed loop system. The other thing I would say is actually it's really hard for providers even within their own system to have closed loops. So this has multiple kind of concentric benefits, even within our own environment, as well as outside of our environment, which is even more challenging.
And sorry, we've talked a lot about what makes healthcare unique, but what should other industries take from your experience in healthcare? What can other industries be learning about what is happening in healthcare today?
There are a lot of unique learnings that healthcare can offer to other health systems in terms of equity, safety, and privacy, as well as just like, what does it mean to offer a quality product? While I mentioned at the very beginning, it's actually really hard to ascertain quality. Each health system is, providers, like incumbent providers of health services, I should say, take quality very seriously. And we don't diminish our product, right? I use air quotes because it's such a personal thing. But that kind of fidelity to the mission of what we're trying to accomplish, which is to deliver, really great care to our communities in a safe, equitable, ethical way, I think can be translated into a lot of other industries. The other thing I would say is just the privacy considerations associated with healthcare and how we treat data. In some cases, they can be challenging and problematic. HIPAA is not, for instance, perfect. It's an imperfect law that we have to work within its constraints. But there are a lot of important things about it as well in terms of protecting patient information that others could use those same lessons in how they treat consumer information. So I think those are the big ones. We hold ourselves to a very high standard and expect that kind of thing. The other thing I would say is just transparency is very important to health systems and to healthcare providers in general, with generative AI being it's really captured everybody's imagination, and we are leaning in very heavily. However, we need to ensure that there's transparency in who we partner with, in the models that we deploy in our system, in ensuring that we've got visibility into algorithms and we can test their ensuring that there isn't bias at a very granular level, understanding the data sets upon which certain models are trained. Like, transparency and the importance of transparency is, I think, another big takeaway for others to learn from health systems.
Well, and you raised generative AI, which is having a moment, as we well know. And I'm curious to get your perspective on something. I recently attended a lunch at the Museum of Contemporary Art in Chicago, and artist Laurie Simmons was talking about AI as her collaborator. And I was not expecting to hear from an artist on what generative AI meant to her. And so I'd be curious how you think about AI. Is it a collaborator? Is it an assistant? What role do you see it playing today? And what role do you see it playing in the future?
There's kind of the three core A's of AI: assist, augment, automate. When it comes to experiences for our clinicians and for our patients, we are really leaning into it as an assistive and an augmenting tool that can support self-service experiences, that can support summarization and triaging and all sorts of other things. We've actually done a tremendous amount of work ourselves on supporting sort of the in-basket management, the provider inbox that has now exploded in the last 3 years because folks have been sort of brought online. Patients are now online and they send their providers a lot of messages on their patient portal, but it's very unsustainable for providers to be able to manage that. And so we've done work in generative AI to support self-service use cases prior to a message being generated, so a patient can actually get their task completed without needing to send a message. We've also done work around triaging and supporting the clinicians themselves on understanding what those messages are, if they do come in, and dealing with them in a much more efficient way. So I think, there's a lot of potential there. I also think there is potential for automation, and that we should not be afraid of that. I don't want to automate away workforce in terms of clinical workforce. Like, we are never going to have as much clinical workforce as we have today. And so we need to be able to support them. I'm not trying to, there's the term, like the notion of automating those jobs away doesn't make a lot of sense. But what I do think we need to consider is that folks who use AI in the future are going to be more prevalent folks who don't use AI in the future. On my team, we oversee marketing. And one of the things that our chief marketing officer says is marketers who use AI will replace marketers who don't use AI. It's like another industrial revolution. Here's an example that doesn't have anything to do with healthcare. We don't have telephone operators plugging in phone lines anymore. We have cell towers. And this is, folks need to think about it similarly. We have folks doing much more value add things now.
Well, and value added, I think, is the key, right? That if you think about the workforce or burnout, or, this is a potential solve to be focused on the highest and best use of people's time versus lower value activities.
That's right. And we have a severe shortage of folks in healthcare right now. So I think it has the potential, if we do this responsibly. There's a lot of unknown unknowns, so we need to start kind of learning in contained and responsible ways. But we can't wait, right? But this has the potential to be like the best thing that's ever happened to our clinicians, our other folks that work in our workforce, to our patients. We just got to do it in the right way.
Well, and a question for you too, related to that. We had a conversation on a previous podcast episode, and it was around talent expectations of use of AI in their work, and that will become a differentiator for employers, essentially. What's your reaction to that?
I think that's right, but also there's training, that needs to get done. It doesn't just happen overnight. And this is really where the responsibility is of adoption needs to be balanced with the training. It's not just, we just take our hands off the wheel. Like, we need to have our hands on the wheel in terms of workforce development and opportunities to ensure that folks can, those marketers, for instance, can become users of AI. I don't think any conversation is complete without that training and development piece of it.
I think that's a great point. And okay, last question on generative AI. I know it's a hot area, certainly. In many of our conversations with clients, the conversation will start with generative AI, but it will quickly turn to data and the data architecture, data needs that must be in place in order to take advantage of generative AI and the promise of it. What's your reaction to that? Is that something that you've been thinking about as well, as far as the connection between data and generative AI?
It's essential. You can't really do any of this properly without data quality. In our case, for instance, de-identified data and a data platform that allows us to do cloud computing on it. There's all sorts of things. We've been working on this. We didn't know generative AI and, like, for instance, ChatGPT was around the corner and October of 2022, right before they released it in November of 2022. We didn't have any idea, but we've been making investments as a system through, our chief information officer and his team, our healthcare intelligence team, in our data platform, in ensuring data quality and ensuring that data has been de-identified properly, that we can actually utilize it, that it's been normalized and standardized and all of those types of things. You can't do this work properly without good quality data. There are lots of opportunities, I think, for data collectives to have a really meaningful role in the future of how technology gets deployed, especially generative AI gets deployed. But you can't skip all that foundational stuff and go straight to the fun part.
Shifting gears now, as you look into the future, what does the future of patient engagement look like?
Well, first, I would say it's not just patient engagement, it's consumer engagement, and it's beyond just those episodic, clinical, transactional opportunities. It's much more holistic. It looks at folks upstream and their kind of needs upstream. So that's kind of big step one. Step two is that when folks come into the system, it is personalized and an experience that we're doing not like sort of cohort based or persona based, but really individual experiences that are knit together from all of the potential stuff about them, around a specific set of a profile of that person. So I think that sort of personalized, relevant experience. And then maybe the last thing I would say is that it's not, again, about right now we think very entity oriented as opposed to person oriented. So it's not just about like a given, providence. It's about what are all of the things that person needs or has interacted with, and how do we, bringing it together around that individual. So it's that sort of whole person centric view around an ecosystem of service providers.
What work would you say you're focused on right now that you're most excited about?
We have been spending a lot of time in what we call identity-driven engagement, which really gets to this notion of know the individual, build a profile, create, use that to power individualized experiences across an ecosystem. So that's of course, very timely and top of mind for us right now. And I think, it's very exciting because we've taken sort of this very patient-centric view over time, very entity-oriented, view over time. And we're on the precipice of changing that as an industry and laying some of that infrastructure and foundation for being able to do that. So I'm very excited about that. We launched a company around it called Priya Health, which we announced a couple of weeks ago, and we're thrilled. So I think that's very exciting. We are doing a lot of work in generative AI, and it's cross enterprise across Providence in clinical use cases, in consumer oriented use cases, in more like knowledge worker, workforce oriented use cases, as well as back office. So all the work that we're doing there and really leaning into the capabilities and the potential for assisting in particular and augmenting our clinicians and our patients in the near term, I think just has so much near term impact that I'm very excited about it.
Well, and I'm curious too, if you feel like you're uniquely positioned in healthcare to leverage generative AI, in that you've always had a focus on privacy or on quality care, that because of that, does that uniquely position you to take full advantage of generative AI?
Providence has been on a multi-year journey. We've unified our infrastructure as it relates to our electronic medical records. So that unlocks a lot of potential. We've made a lot of investments in our data platform, as I mentioned. We are on a single cloud-based instance of our ERP solution. So we're a partner with Microsoft. So all of these things that our organization has invested in have allowed us to have a bit of a head start now that we are sort of in this generative AI moment, as you described it. We are well positioned to take advantage of it, but also work with others to kind of help shape what the future is going to look like.
Sarah, we like to ask every guest on the podcast, what does digital mean to you?
Oh, this is a great question. And it's actually one of the things that we spent a little bit of time focusing on. Digital can mean you ask one person, you've asked one person, and every answer is different. I'll say what our reason for being is in the organization is to drive sustainable growth for our system. And we do that by essentially bringing, again, crudely, buyers and sellers together. So we bring our clinicians and our patients together. And we do so in service to what we call the sacred encounter. That is what we are here to enable for our system. So it's really about generating demand, capturing that demand, and then how it translates into is that sacred encounter.
Fantastic. For people that would like to stay connected with you and what you're up to at Providence, what's the best way for them to do so?
We have a couple of different ways. So we actually have a digital innovation group website. It's providence-dig.org. And if folks want to follow me directly, they can find me on LinkedIn. We're very active in trying to get the word out about what we do. So please do follow us on LinkedIn. We also have a Providence Digital Innovation Group LinkedIn as well.
Well, Sarah, what a terrific conversation. Thank you so much for joining us on This is Digital.
Thanks for listening to This is Digital. If you enjoyed today's show, please follow or subscribe on your preferred podcast app. And don't forget to leave us a review. For more information on This is Digital, visit westmonroe.com/thisisdigital.